Good afternoon, everyone, and welcome to the next chapter in our series of aquaculture-related webinars designed to bring together science and business to expand and strengthen the United States aquaculture industry. These webinars are a joint effort between the National Aquaculture Association, the North Central Regional Aquaculture Center, and the United States Aquaculture Society. Whether you're currently engaged in aquaculture, looking to get into business, an educator helping others understand aquaculture, or just want to become a better educated consumer, we hope that these webinars will enhance your knowledge and move you forward on your journey to success. Today's webinar is entitled Use of Veterinary Feed Directive Drugs in Aquaculture and will be presented by Dr. Pat Gaunt, a professor of aquatic animal health at Mississippi State University's College of Veterinary Medicine Fish Diagnostic Laboratory in Stoneville, Mississippi. Dr. Gaunt is a leading scientist for the fish health community and serves on the American Veterinary Medical Association's Aquatic Veterinary Medical Committee. Dr. Gaunt's research efforts are focused in the areas of fish health, toxicology, and pharmacology. Notably, she's performed pivotal studies with Aquaflor, leading to its approval as the first veterinary feed directive aquaculture drug in the United States. And don't forget to tune in at 3 p.m. Eastern Time on November 15, whenever Sarah Cornells will discuss the successful use of social media for aquaculture. And with that, I'll turn it over to you, Pat.
Thanks very much, Alan. I appreciate being asked to present this talk on veterinary feed directive drugs. I've been writing VFD orders for over 10 years, and I was involved in the process when Aquaflor was approved under the first VFD rule in October 2005. I know that the new second rule seems complex and there's concern over several of its issues, but the process is very similar with just a few changes to what has been done in the last 10 years. I want to review a little bit of the history of VFD drugs with you. Before 1996, the drugs that were in use for animal feed were either over-the-counter or they were prescription, and in some states, prescription drugs were actually illegal for animal feeds. In addition, FDA wanted tighter control over antimicrobials. This is a theme that we're going to see also with both the first and the second VFD rule. There was public concern over the environment, for residues in food, and antimicrobial resistance as well. The Veterinary Feed Directive Order and the Veterinary Feed Directive Drug were both created by the Animal Drug Availability Act of 1996. It's a part of the Federal Food, Drug, and Cosmetic Act. Under the first VFD rule, the definition of a VFD drug was that it was a new class of animal feed drug. So a veterinary feed directive order is a written statement issued by a licensed veterinarian that orders the use of a VFD drug in or on animal feed. And FDA issued the first VFD rule in the year 2000. As I mentioned before, VFD drugs are regulated by the FDA. They can only be used under veterinary supervision with the intent to reduce bacterial resistance and to prolong effectiveness. FDA approved Aquaflor as the first VFD drug in aquaculture in the year 2005. And initially, its use was only in catfish for control of mortality associated with enteric septicemia in catfish. The label claim for fluorphenicol has since been expanded to include columnaris disease and other label claims in freshwater salmonids and other fishes. This is just a little slide to clarify categories and types of animal drugs that will help you understand part of the label that is attached to some of the medicated feeds. Animal drugs are going to be categorized as either 1 or 2. And 1 is the least likely to generate unsafe residues, with 2 more likely. So there's a required withdrawal period associated with category 2 drugs. And our medicated feed antimicrobials are going to be Category 2 drugs. They require withdrawal. The types of animal drugs are going to be A, B, and C. And type A is a medicated article that comes from the sponsor of the drug, and it's used only to manufacture another type A article or in the manufacture of a medicated feed. Type B medicated feed is a very concentrated form of medicated feed, and it's not going to be used to feed the animals directly. Type C is actually the medicated feed that can be fed to animals. So our animals, the final product for feeding our fish will be a Category 2 Type C medicated feed. And indeed, because Aquaflor is a VFD drug, it is a Category 2 Type C medicated feed. And you can see this on this label that's circled up in the upper right-hand corner. It is a Type C medicated feed. And at the bottom, you can see in the red circle that it has to be withdrawn 15 days prior to slaughter, indicating that it's in Category 2. This schematic illustrates how a VFD order is generated. The veterinarian writes the VFD order and issues it to the producer. It is also the responsibility to make sure that a copy of that order gets to the feed distributor. So the veterinarian can directly send the order to the feed distributor, or if the producer is going to the distributor, they can bring that order with them and hand deliver the order to the distributor as well. Now, a distributor is any person who distributes a VFD medicated feed to either a manufacturer to a client. And a distributor can either be a dealer, such as we see with a co-op, or it can be a manufacturer of the feed, as in a medicated feed mill. They also, a manufacturer has to have a license in order to manufacture this feed, and we'll talk about that in just a second here. So as far as the veterinarian's responsibilities are concerned, the veterinarian, number one, has to be licensed to practice in the state where he or she is seeing the fish. And there has to have be a valid veterinary client-patient relationship in order. And with the new VFD rule, there's some flexibility on what this VCPR can be. Before the second rule came out, it was a federally driven VCPR. Now it can be through the state in compliance with the state veterinary licensing board's requirements. Minimally, what has to happen here is that the veterinarian has to assume responsibility for the fish health. They have to have recent knowledge of either the patient and or the facility, and they have to have be available for follow-up care. So if a state does not have a VCPR written into its code, its practice code, or if it doesn't meet these minimal federal standards, the federal VCPR will automatically kick in. What's nice about having the state VCPR is that state licensing boards are well aware of the circumstances of veterinary practice within their state. So for fish practitioners who are in rural areas where the geographical areas are really, really large, and it makes it difficult for either the producers to get in to see the veterinarian every time there's an outbreak, or for the veterinarian to go to the farm every time there's an outbreak. Some state license boards can work with veterinarians and with fish health professionals on the farm, and this is all written into their practice codes on what they will allow and the oversight that the veterinarian has to give in order to have a valid veterinary client-patient relationship. So with all of this, of course, the veterinarian has to maintain their medical records, and they have to use any medication, VFD medication, that they choose to order properly. There's no extra label usage of VFD drugs. There has to be prompt treatment. A lot of times these fish with bacterial diseases will go off feed, and you will not get an adequate dose in the fish if you wait too long to treat these fish. And the veterinarian has to comply with a proper regimen as the feed is labeled. The veterinarian also has to issue all of these VFDs in writing with all the required information. And we've already talked about the requirements for record keeping for FDA inspection and ensuring that both the client and the distributor retain a copy. The client also has to cooperate with the veterinarian to maintain a valid veterinary client-patient relationship. They have to follow the dose rate, duration, and expiration date, and the withdrawal times also on these medicated feeds. And they too have to maintain their copies for FDA inspection for 2 years. The distributor has to notify FDA prior to their distribution of VFD medicated feeds. They also have to have a signed VFD order prior to the delivery of the VFD feed to the producer's facility. And they too have to maintain their records for FDA inspection. The manufacturer has to be registered with FDA and possess a medicated feed mill license. They can manufacture VFD medicated feeds without a signed order. They have to maintain their manufacturing records for 1 year, and these have to be available for FDA inspection. If the manufacturer is also the distributor, they are also required to keep the VFD orders available for FDA inspection for 2 years. This is an image of a VFD form that is provided by Aquaflor, or fluorphenicol sponsor. A VFD form can also be made by the veterinarian. There are some generic forms that are found on FDA's and AVMA's website. And so if these forms that are made by sponsors are not available, the veterinarian can produce their own forms. There is a certain amount of required information that has to be on these forms, and we'll talk about those next. The VFD form has to have the name of the drug, and you can see on this particular form that Aquaflor is in prominent display in the upper left-hand corner. There also has to be the farmer and the veterinarian's name, address, and phone number listed. The animals have to be identified. The ones that are treated, including the species, the approximate number, and the production class. And room for that is in the box that's circled by the green circle. And within the yellow circle, we list the condition or the disease being treated. And there's several label claims for Aquaflor. It's label for treatment of furunculosis associated with Aeromonas salmonicida, for Flavobacterium cycrophyllum, and for Flavobacterium in freshwater reared finfish, enteric septicemia in catfish, and Streptococcus septicemia associated with Strep Iniae in freshwater reared warm water fish. And those are all the indications that can be used when you're using Aquaflor to treat You can't extra label this drug at all. The manufacturer has listed suggested, or not suggested, but these are the label indications that you can use as 10 milligrams to 15 milligrams per kilogram body weight. These are approved dosages labeled by FDA. For strep, it's 15 milligrams per kilogram body weight. And if we come down one more within the purple circle, what has to be listed also is the feeding directions and the amount of drug to be mixed and the duration of use. So this fluorophenocal active ingredient is in the medicated feed to provide 300 grams of fluorophenocal per ton at a feeding rate of a certain percent biomass. And this is set by local custom. Here in the Mississippi Delta, we use 2% sometimes, and sometimes we use 3% for the biomass. So it's more of what the farmers are demanding as far as the feeding rate is concerned. And this is to be fed as the sole ration for 10 consecutive days. So the manufacturer of this drug has done a nice job in listing the biomass for the feeding rate here. And with that, they've calculated the grams fluorophenocal per ton of feed if it's fed at a 10 milligrams per kilogram body weight, and then if it's fed at a 15 milligram per kilogram body weight. And in the very right-hand column, they've listed the biomass of fish that can be treated for 10 days with 1 ton of feed at that particular feeding rate. Okay, also listed on this form, it's a very long form, but this is required information by FDA. The following statement: extra label use is strictly prohibited. Cannot use these. Extra label use in any VFD drug. The affirmation of intent for combination drugs. We'll talk about this in just a second, but I can tell you right now, there are no combination drugs that can be used with VFD drugs. So for us in aquaculture, the answer is that there are no combination drugs that the veterinarian can select to put in that VFD feed. Okay, and then also that must be listed any warning or cautionary statements or special instructions, such as the residue warning. And you can see within these little arrows down here that fluorophenocal must be withdrawn 15 days prior to slaughter. Also listed is the veterinarian signature down here and the date of issuance and the expiration date. Note that it's not to exceed 6 months from the date of issuance. Prior to the second rule, this was 15 days from the date of issuance. It has been extended up to 6 months from the date of issuance, and we'll talk about this also in just a second. And the number of refills, if it's permitted by the approval, and currently there are no refills allowed in VFD drugs for aquaculture. Some optional information on VFD order forms that can also be included. Any more specific information on the treated fish, such as if you want to list if they are indeed in the 10-acre ponds, the approximate age or weight of the fish, and any additional information that the veterinarian would like to include. There is a comment box on a VFD form, and it's blank, and the veterinarian can list any other information in there that they think is pertinent to the facilitation of getting this drug to the distributor and ensuring that his or her orders are followed. As I mentioned before, there are some generic forms on the websites, and the veterinarian can also create their own VFD form. Now, so the question comes up, well, if you have to create your own form and no one's calculated how much medication needs to go in a ton of feed. How do you do that? And this formula here will help you out. So the concentration of medication in the feed is equal to the dose rate. It's the quotient of the dose rate divided by the percent feeding rate. So for Aquaflor, if we're feeding at 10 milligrams of fluorophenocal per kilogram body weight, and the percentage feeding rate that we're using in the Mississippi Delta is 2%, 10 milligrams divided by 2% is going to give you 500. And this is a 500 parts per million. It's 500 milligrams of fluorophenocal per kilogram feed. So there are electronic forms if you don't want to mess with the paperwork. And they're available through Global VetLink and DVM RX Express. This is an electronic submission of the VFD orders. And it has to be compliant with regulations. Part 21 on the regulations. It's sent under secure email and our database to feed instructors and producers, and it's only accessible by parties granted access. The big advantage here is it's going to decrease the paperwork. The disadvantage is that there is a monthly access fee and an account maintenance fee as well. Just to clarify, if you write out a hard copy of a VFD order and you PDF that order and email it to the distributor, that is not really an electronic submission, okay? Because you have the hard copy that you sent, and that hard copy has to be retained. The hard copy original is retained by the veterinarian, and the producers and distributors do have to maintain the copies of those orders. So here are the links down here. If you're interested in pursuing the electronic version, Global VetLink and DVM RX Express. I've talked with both parties, and they're very nice and very helpful. So if you just want to talk and get information, I'm sure they'll be willing to educate you on their process. So let's talk about what's new in the new VFD rule. How does the second rule differ from the first rule? Okay, probably the biggest thing here that we're dealing with right now is the expiration date. And we've talked a little bit about this. In the second VFD rule, the VFD order expires within 6 months of issuance, okay? And that's at the veterinarian's discretion, okay? If the veterinarian feels that it's justified in writing this order that doesn't expire by 6 months, the veterinarian can do so. However, if the veterinarian feels that this order should only be written for 20 days, then the order will only be written for 20 days. So it's not an automatic 6 months on these. It's a discussion between the veterinarian and the client, and there's a valid veterinary client-patient relationship, and the veterinarian understands the husbandry conditions and the needs of the farmer. So it's a back and forth conversation, but the veterinarian ultimately makes a decision on the length of time that expiration date will be for the second for the VFD order under the second rule. And this is actually in effect right now for Aquaflor, okay? It went into effect on October 1st, 2015, and it will be in effect for Romet and Terramycin January 1st, 2017. Now, what's not new here is the duration of use, but I want to talk about this anyway, because a lot of people get expiration date and duration of use confused, and they're completely different. The duration of use is part of the label claim. Okay, it's part of the approval, the conditional approval, or the index listing for the drug. Okay, for example, for fluorophenocal, this drug is given 1 time a day for 10 days. Okay, so that's something that FDA approved and that cannot be changed by the veterinarian or the producer or anyone. Okay, that's set. If the VFD order expires prior to completing the duration of use, the veterinarian does have to issue a brand new VFD order. Okay. Okay. Under this second rule, the first rule was modified, and it was based on FDA guidelines 209 and 213. And 209 wanted to eliminate the production use of antibiotics, and so phased in veterinary oversight for therapy. This is kind of the same thing that we talked about for the initiation of that first VFD rule, where they wanted the veterinary oversight. Okay, but this one spelled it out. They don't want production use of antibiotics anymore. And in 213, this changed the marketing status from over-the-counter to prescription if the drug is used in water, such as oxytetracycline hydrochloride. That's a marking agent. Come January 1st, 2017, that is going to be a prescription. And the VFD feeds will come into play January 1st, 2017 also. So all these over-the-counter medicated feeds, Romet and Terramycin, will be VFD feeds in January 2017. Currently, under the second rule for Aquaflor, the distributor and the producer, not the veterinarian, will calculate the quantity of feed ordered. Okay, previously, it was the veterinarian, but it's not anymore. The veterinarian can participate this, but is not required to do so. Okay, here's this affirmation of intent that we talked a little bit about previously. And if a combination feed contains greater than one VFD drug, greater than or equal to one VFD drug, the combination has to be ordered with a VFD order. Okay. Well, there are no currently approved combination veterinary feed directive drugs or veterinary feed directive drugs with over-the-counter drugs in aquaculture. Okay. So for now, this is a moot point. It's going to affect other species of animals, but it's not going to affect our fish. Okay. It could possibly in the future, depending on what's approved, but this is something that has to get, the veterinarian has to address in these, the VFD form. And if you come across it, you will see that the box is checked that, that we are not accepting any currently approved combination drugs in conjunction with this VFD order. You can read more about this under the Code of Federal Regulations section that's listed here. Okay, so the orders can be transmitted in person, by fax, or electronically. Still, no telephone orders. That's the same thing as it was in the first rule. The electronic orders, if they're true electronic orders, they have to be compliant with Part 11, okay? And to my knowledge, those two companies that we mentioned previously are the way to go if you're going to do electronic orders. Keep in mind that emailing a hard copy and making a PDF out of that hard copy is not the same thing as an electronic order. We've already talked about maintaining these orders for FDA inspection for 2 years. The veterinarian does keep the original one. And there are no refills allowed with VFD aquaculture drugs at this time. So here's a feed label with information. We've kind of looked at this one before. We know that this is a type C medicated feed, and it's a category 2 because there is a withdrawal period here, 15 days prior to slaughter. It has to be issued by a licensed veterinarian, and it gives complete use information, including feeding directions, warnings, cautions, and refills on here as well. So these will be on bags of feed, or these labels will come with loads of feed, depending on what's being ordered. So here's an example of VFD orders and expiration dates that we talked a little bit about previously, but I want to show you this example because I think it's a good illustration here. If a producer comes in to see a veterinarian and pond 1 is stocked with catfish fingerlings and it breaks with enteric septicemia of catfish, okay, and there it is. And the producer tells the veterinarian that ponds 2, 3, 4, and 5 are adjacent fingerling catfish ponds. And there's real concern that these ponds are going to break too. And they want to have this feed on hand in these ponds in case these ponds break, because he's pretty sure based on previous history, they're going to break with ESC. Okay, but you've only seen fish from this pond. The producer needs the VFD drug to treat ESC in this pond. And so he's requesting a VFD order with a 10-week expiration date to cover the fish in ponds 1 through 5. So sure enough, here it is. It's May 1st through 10th, and he's going to treat this pond 1 with the VFD drug. And then about 10 days later, pond 2 breaks, and he treats that pond. And from the 21st through the 30th, the third pond breaks, and it's just moving on down the line until June 25th through July 4th. This is the last outbreak of ESC. So he's had this VFD feed on hand throughout this outbreak of ESC, and has been able to treat very quickly and get the fish to consume the feed, and it seemed to work. If pond 1 breaks again with ESC after May 1st through 10th, there are no refills, okay? A new VFD order has to be issued for this first pond. Okay, here's the other big thing about this second rule. There are no extra label use of veterinary feed-directed drugs, okay? This has always been the case, even with the first rule. FDA CVM realizes that there are very few drugs that are available for aquaculture, and they're considering regulatory discretion for extra label use with the new VFD rule. We don't have it yet. The final decision is going to be announced when the final transition of these over-the-counter drugs of terramycin and Romet take place. And that's going to be on the 1st of January, 2017. So this is going to kind of sum up what we've been talking about, the highlights of the second VFD rule. It went into effect and impacted Aquaflor in October 2015. The veterinarian can extend the expiration date up to 6 months if he or she thinks it's necessary. On the forms, the VFD order forms, the production class, and the approximate number of fish required, rather than the fish biomass, has to be listed. Instead of the veterinarian, the producer and the feed mill are going to calculate the quantity of feed. The target date for converting the over-the-counter medicated feeds to VFD medicated feeds is January 1st, 2017. There is no extra label use of veterinary feed directive drugs, and FDA is considering regulatory discretion for extra label use and will announce it with its final rule in January 2017. And I thank you very much for your attention and taking the time out to hear this talk this afternoon.